Hi everyone, this is Tori Vandelin with Prevent Connect. The podcast you're about to listen to was recorded in July 2020 when Ashley Klein Jimenez and I got to talk with Janae Sargent, Lluvia Cervantes, and Morgan Martinez about how their respective organizations have adapted prevention programming in the time of the COVID-19 pandemic. Our current context is always shifting to adapt to this crisis and other compounding and ongoing crises. And we hope Janae, Lluvia, and Morgan's conversation brings hope and inspiration to you, as it did for me and Ashley. Take care and enjoy the podcast. So, thank you everyone so much for joining us on this podcast today. My name is Tori Vandelin with Prevent Connect, and we are really jazzed to talk to you all. We are recording this in early July. I feel like we have to say that on our podcast now because context changes so quickly, especially when we're talking about how folks are responding to the coronavirus pandemic. So this is early July 2020, and we are so excited to talk to you all about the things that you have done to support your communities during the coronavirus pandemic. I'm so excited. I have my co-host here with me today, Ashley Klein Jimenez. Ashley, how are you?
Hey, Tori, I'm good. I'm really looking forward to this conversation.
Awesome. So before we jump into the conversation, our guests that are on the podcast today, can you take a moment and introduce yourself, your agency, and your roles?
Absolutely. My name is Janae Sargent. I use she, her pronouns. I am the Prevention and Education Manager at RISE in San Luis Obispo on the Central Coast. We are a dual sexual assault and intimate partner violence agency.
Hi, I'm Morgan Martinez from pronouns she, her, hers, and I'm from Valley Crisis Center in Merced, and we are also a dual sexual assault and domestic violence agency, and I am the youth program specialist for Close to Home in Planada.
Hello, my name is Lluvia Cervantes, and I also work for Valley Crisis Center, and I am the adult program specialist for Close to Home in Planada.
Great, thank you all. So the reason that we asked you to be on the podcast today is that we heard that you all were making masks as part of your sexual and intimate partner violence prevention activities, and making these masks after the coronavirus pandemic really amped up earlier this year, and handing them out to community members. So how did the idea to shift prevention activities to making masks to protect against coronavirus transmission come to fruition?
That's a great question. I think for us, in 2020, when you talk about sexual violence prevention, you're not just talking about teaching people how to not assault each other. It's so much more intersectional than that. And we talk about what puts people at risk in their communities, what makes people feel isolated in their communities, and this increasing need to be authentic in your community and respond to them and listen to what they're driving. So for us, it actually started from CalCASA. One of our RPE trainers, our grantee trainers, sent out an email just kind of throwing out this mask idea. And it just seemed like such a perfect pivot for us because it didn't really feel authentic to try to continue on with our programming like nothing had changed when so many people in our community were really struggling. So that's how we got the idea. And it was, I think, a really special and timely step. So, thanks to CalCASA for sending that out.
Yes, so with Prevention in Planada, what we did at this time was, it was the time of lockdown, and we really thought about our seniors for our Living Well Cafe, where the seniors get together and they get, time for them to share games or laughters, whatever they need to do for them, for to escape their daily lives. And I know the center was going to be closed, and I know that the seniors are people that don't have resources out there, and we saw that this virus was going on, and we worry about their health. So we said, why not try to do masks for them? And what we did, we actually ask our members, our group members, if they will be willing to help the community, as well as preventing to get sick, prevention of worrying more about what's going to happen. And they said, we would love to do it for the seniors because they're vulnerable. And so what we did, we got the cloth, but also before we got the materials, we talk about how April was the sexual month awareness month for sexual assault. So we said, why not make it the teal color as well? And we can combine both of them. We can show them that not only are they receiving masks, but they're getting educated on the fact that it's April, the month of sexual awareness. And we actually put a little logo on their mask as well. So they were finding out the information about the mask meanings too. So if someone would ask them, they knew what to respond back to them and tell them the meaning of the symbol on the mask. So we thought it was kind of unique, and it was really nice that the group members, the youth and the adults got together and started doing the masks so we can pass them out to the seniors. And then later on, it turned out to be to more than just seniors. We did it other families in the community as well.
That's so great. This is Ashley, and I mean, I really love the way, excuse me, you all are thinking about prevention being so much more expansive than, you know, teaching people, providing education or teaching people skills, but really seeing it from, you know, creating safe and supportive community environments. And so I really love that that's your lens. And then that focus on, you know, who's most vulnerable in our communities and how can we connect supporting some of their needs to also helping to increase their awareness about sexual violence. So that's really cool. I'm curious to hear from you about how the community members responded to your mask offers. What was that like?
For us, it was really heartening, and we did it a little bit different. I think that's what's really nice about our two agencies being on here is we had the same overarching idea, but they were implemented really differently. So we had make your own mask kits. They came in brown paper bags. People could either call our agency and order them, or they could order them online with a Google form. And they were also teal for Sexual Assault Awareness Month, but we really branded them as just, these are free mask kits. Everyone needs masks right now. And then we included a lot of materials about local resources, knowing your rights if you're at home with someone who's toxic or unhealthy. And what was so special is we had about 230 orders from people in the community. And a lot of those people were people who have not been involved with RISE before. So we had a lot of college students. We had a lot of families of college students because we partnered with the local university and they sent it out to a listserv. So it was really nice to have this accessible piece that people could interact with, and then you're bringing it to them and they are in the comfort of their own homes, and then they're seeing your materials and perhaps hearing about you when you've never heard of them or when they've never heard of you before. And we had also asked, we did a challenge asking people to post photos in their mask and explain what Sexual Assault Awareness Month means to them or what they're doing to dispel some of the myths about sexual assault. And our local mayor got involved. We had a bunch of people posting photos and they're kind of happenstance, make your own mask. And it was really nice to see pieces of the community get involved with this work that usually don't.
Yes, and like you said, I think that's the beauty of knowing that each community is unique and very different, and that as our representatives, we got to know our people in the community, what the community is capable of, right, and the resources that they have. And of course, the seniors are more vulnerable. They have times, hard time seeing and things, or their hands shake. So that's why we couldn't just give them, like you guys did, the tray so they can make their own mask. But that's why we said, we got to see too, how can we help them out? So in our case, in our community, Planada is very small and the majority of them are seniors. So that's how we just made the mask for them as well. But it was really also unique that our community members, the leaders from other organizations, they took our mask and they help us by passing the mask together with a little bottle of sanitizer. So the hand sanitizers or make your own hand sanitizers was from another organization in Planeta that worked with us. So now we combine our teal mask with that other organization working together close to home, working with some business of Paul. And it was really nice. The community liked it. And then we find out later on that a mask was required to wear going into the store, to a local store. Without the mask, they couldn't go. So there was a family that, this is a single mother in Planada that wanted to go buy her needs at the store. She was the only one wearing the mask because she didn't have one for the kids. So she goes in the store and they told them that the children had to wait outside because they didn't have no mask. So of course, she got mad. She went home, and her concern was more, well, where am I going to get masks? I don't have the money to go buy material to make the mask, and I don't drive. So one of the group members from close to home in our group, she find out about the situation. So what she did, she went the next day to the store right before they opened the store, and she was outside the store waiting for people to come to the store, and she would see someone not wearing a mask, she would offer one for free. And she was also taking the advantage of talking about the program. It's like, oh, this is something we did. This is the name of our program, Alebrijes Implanada, and we're helping out the community by giving out them protection for the virus, which is the mask. And she was giving them out. The ones that she made, she was giving up to the community out at the store at that time. So I think it's really unique just how we all in a different community just come together and help each other. I think it's really cool.
Another bonus about us making these masks with our participants in Planada is our agency, Valley Crisis Center, was hosting a virtual SAM event where we were just posting photos on our Facebook page for Denim Day, and we actually got some of our participants to wear the teal masks and denim and take photos to post on our VCC Facebook page, which was awesome as well.
That's so cool. Thank you so much for sharing that story. And, it sounds like the community, you really did meet a need that was really important in that moment. And so how cool is that you were able to impact people beyond the work that you usually do. I'm wondering, when you, and I don't know, maybe you didn't have to take this up with anyone else at your agency, but if you did have to talk to someone else at your agencies and say, hey, we have this idea, we want to make these masks, was there any sort of like explaining you had to do to link that activity to your work to prevent sexual violence? And if so, what was that conversation like? Like, how did you link the two together to make them see that they really are linked?
Yes. So in our case with VCC, like Morgan said, it was SAM, right? And they were trying to figure out something because we were going to do a marathon. VCC was going to do a marathon to raise awareness and to raise money for sexual assault victims. But because of the virus, it got shut down, we got canceled. So they were worrying about how they were going to, I know that we were going to be able to raise money, but how were we going to be able to send the message out still, without doing the marathon. So I heard them talking about that. And then I heard about our seniors in Planada, what was going on. Then I heard on TV and the news that it was time for us to start wearing masks. So we were in a meeting with our coaches, and I was in the meeting with my supervisor, and I said, I think I can probably solve both of our problems. I just don't know if I'm okay, if it's going to be okay with it, or if I'm giving out the right idea. But how about we do this? How about we help give out awareness through a BCC, through our teal, like wear something like a mask and let it be blue or the teal blue color that it represents. the sexual assault awareness. And then they liked the idea. So then one of our other coworkers at BCC said, well, we have the machine to make t-shirts and make labels. Let's make the little the ribbon and the logo of Sam. And she did it in English and Spanish. And then when the masks were ready, we just took them and we actually ironed those um, steel ribbons on the mask. And I think at first I was kind of hesitated to say it, but I thought it was a great opportunity just to make, how did they say, like kill two birds with one stone? And I was like, there you go. We can take care of our people as a prevention team, and we can also give out the message to help BCC with this idea too of sparing what Sexual Assault Month is.
Yeah,
I love that. Sorry, I just wanted to say, I mean, that truly is like the heart of a preventionist, is finding solutions. So thank you so much for that story.
I was just going to say it also really resonated with me, and thank you for saying that. I think I saw it as a great opportunity to make some connections and do some cross-educating within agencies. There's often such a divide between direct services and prevention, and that's just because we operate in such different worlds, even though we're all committed to ending sexual violence. So any opportunity that we have to explain prevention and bring other staff in on that is really powerful. One of my favorite things about the teal mask movement, that's what we called ours, was that we had a lot of staff in North County. So our agency has multiple locations. I am in the central county, and that's where a lot of the prevention people are centered and the program people are centered. And then in North County, there are staff that I don't really get to interact with. And they ordered masks, and it opened up some conversation with us about what the masks were for. I got to deliver them to their houses. We drew in a lot of staff when we were creating our resource booklets, and we were translating our resource booklets and compiling different things in the area. It was just such a nice way to draw people into our work because they could see the connection, because they are always responding to people's needs and empowering people in that way. And we were doing that, but we were also increasing community connection and doing prevention work. So it's one of those really beautiful opportunities where we can work together on the same project.
That's really cool that you all found connections in your community and with your community work and with your colleagues too, with having multiple locations. And I really like the feed two birds with one scone, the solving the issue of needing to raise community awareness and bring prevention messages out into the community during Sexual Assault Awareness Month, and meeting a community need for the mask requirements so folks can meet their survival needs too. Thanks for listening. A second part of this podcast continues our conversation with Janae, Lluvia, and Morgan. A link is available on this podcast page on our website.